Today we're talking about how to lock the knee, why to lock the knee, and how it's going to help your body. Have fun. Okay, so today we're going to talk about why to lock the knee, how to lock the knee, and how that's going to make your life better. So generally, there's different traditions, right, in yoga, and especially in Bikram yoga or the Ghosh tradition, we talk about locked knee a lot. But then you go read older scripts of older traditions like Iyengar and Krishnamacharya. They all actually talk about a locked knee a lot if you look into the posture descriptions. So that's not a new thing. Knee pain can have so many reasons. And I am not saying, I'm not going into diagnosis. Please talk to your doctor about this. But generally, what I can tell you is in yoga, we want to learn to strengthen the leg so much that the knee is going to relax the strain that it has, or your body is going to feel less strain on the knee. Eventually, over time, it will heal whatever problem you have. In most cases, right? So locking the knee, first of all, does not mean to push the knee back. It means to pull the kneecap up and to get the ankle, the knee, and the hip in one line. If that is not happening, then that's just pushing back. That is not what we do. Generally, the knee is a misunderstood joint in a way that it's not a hinging joint. Actually, it's a roll and glide joint. And that means that femur and tibia do not actually fit completely onto each other unless of the last 30% of the extension. So full extension, meaning pulling the kneecap up, you will have a slight rotation in the knee joint, and then a glide forward, and the femur and the tibia will fit exactly on top of each other. And that is also when, if all the muscles around the femur bone are equally strong, there should be no stress, either inside or outside of your knee, right? So should be, because that's not the case. In most people, we have imbalances, and we either come, like I have a lot of students coming like this, and a lot of students coming like this. So generally, it just means that you're not training the muscles equally, and you can fix that in yoga, for example, by locking the knee, right? So we're going to pull the kneecap up, tighten the quads, and the hamstring is also going to be activated in this extension, but it's mostly here in the front thigh. When I talk about people with X legs, it's mostly the foot that is the problem. Like often I see students come in, they have a weak foot. So they turn in here in the ankle joint, in the lower ankle joint. And then this travels on. So they push into the ankle joint, and then the knee turns in, and then the hip is hurting. And then the back is hurting, and it goes all the way up to the brain, right? But funny enough, everyone I've worked with, they can get rid of this problem within 3 weeks. They are like halfway down, and in, I don't know, let's say maximum 3 months. My students usually have fixed their leg problem, their foot problem, but you need commitment, right? So what am I saying? Whenever you are balancing on one leg and you're locking the knee, this is when you should be pulling this arch up. Your foot should be strong. So it's a little bit grabbing the floor, similarly to when we are using the fingers to grab the floor in any posture to not compress the wrist. We're doing similar thing here to pull up all that tendon complex, and we're using the strength so that the anchor is not turning in or out, but actually being in one line with the other joints, right? That's what we're trying to go for. And then that's going to make you sore in the beginning. That's all right? It's a good soreness. If you have any sharp pain, then stop and contact me or your doctor. But generally, this is a good guideline. So hyperextension often occurs in the same people that have weak feet and turn in already into their flexibility, right? So often you think you're not flexible, maybe because you're built quite big, or you have a lot of muscle from former sports. I've seen this so many times. Big, huge guys, they're usually all flexible if they have this problem. And you need to embrace your flexibility. It's actually worth something, but you need to learn to strengthen it, right? So if you are one of the people who are pushing into their ankle joint and therefore pushing into their knee joint, and then have outer knee pain and pain in the back of the knee, it's most likely that you're also hyperextending. And that just means that you're pushing the leg back whenever you're doing anything on the leg. I can't even do it if it doesn't feel good for me. But so you want to not do that, right? Pull up, think up, not back, up, right? Activate all these muscles. So we have the front thigh, we have the back, with the adductors and abductors. They're all important for the knee joint. All of the exercises you can do that strengthen any part of that leg, and as well the calf muscles, is going to help with any strain on the knee. But it will not fix if your problem starts already in the foot, right? So look at your joints, check in the mirror if you have one. I'm sure you find one. And then make sure you find a way to align your joints on top of each other. And that is the first step. And then use your feet, strengthen your feet. And from there on, strengthen the leg muscles, strengthen the butt. It will help all the knee problems I've seen so far. And then there's one slight other thing. A lot of knee problems occur as well with the hip tightness. So they're doing a posture like this and it's going to hurt in the knee because the hip is tight. Sometimes IT bend. So we need to also work on flexibility, not just strength. Often big muscle groups overcompensate for smaller groups, and then or weaker muscle groups in your body. And then so the part that is already stronger is going to tighten. And then you're losing flexibility there. And you have too much flexibility on the weak side, right? So that happens a lot. And I see it enough, even in a posture like this, when the foot is turned out like that, and they're going to complain about knee pain. It's actually because you're twisting the joint. At this moment here, you're twisting the joint. You want to keep the foot close to the butt. You want to just fold the leg and then take the pressure away from the knee. That usually helps already. And same thing for pigeon or trees, all these postures where you are actually going into the flexibility of your outer leg thigh. Same thing if you're going to twist your joint here. So if the heel comes up that way, but your butt is pulling back, that's when you're going to hurt a lot, right? That's going to damage or put strain onto your knee. So make sure you're using your muscles from the foot on all the way up. In this way, we are not aligning them in one line, but you can be aware of whether you're turning, twisting your ankle and then turning, twisting your knee. And if you are just taking care of that, not to rotate too much, that's gonna change already most of the problems, okay? This can even occur in standing postures. So let's say this posture, if you are turning the thigh in, but the tibia out, for example, that's also already a slight twist. Or if you are doing a warrior pose, same position, a lot of people have knee pain in the inner knee in a warrior or lunge, then that is probably because you're turning the heel in, turning the tibia out, but then pushing the femur back in, you're twisting in the knee. So make sure if you have this pain that your legs are a little bit more wider apart, and then try and learn to lock it first and then stretch into that stretch, right? So slowly, with breath, with control, that is how we do yoga. Okay. Well, I hope this has been helping for your practice or for your teaching if you're a yoga teacher. I wish you all the best. Thank you.